We're going to conclude our videos for today with a discussion about nuclear medicine, which includes imaging studies like positron emission tomography or PET, PET or PET, bone scans, and single photon emission computed tomography, also or better known as SPECT, S-P-E-C-T. So this imaging modality is performed, or these imaging modalities, I should say, within nuclear medicine are performed by administering a radioactive compound called a radionucleotide or a radiotracer, sometimes just called a tracer, that's usually generated on site using a cyclotron due to their extremely short half-lives of minutes to hours. The location of the radionucleotide in a patient is then analyzed using a gamma camera, in the case of the bone scan, or a positron emission scanner. So the type of radionucleotide that's used is based on the different affinities of various tissues to biologically active chemicals like iodine uptake by the thyroid, glucose utilization in the brain as well as in other organs of the body, and then phosphate usage by the bones of the body, and that's how we do bone scans. So if you look at the images captured in nuclear medicine, they often look somewhat similar to X-ray since they're 2D images of 3D structures. But we've been able to make some advances in this field recently where we can do overlays with CT scans and these sorts of nuclear medicine-based imaging modalities. So just looking at what we have up here, you can see a couple of different types of nuclear medicine-based images. So in the upper left-hand corner, the white images that you see there, those are representative of bone scans. Right below that, on the bottom left-hand side, you can see three foot images. The two on the outside are going to be X-rays. The one in the middle is a bone scan. And so what this is showing you is if you look on the far left-hand radiograph where the circle is, again, we're looking at the third metatarsal there, and you'll notice that you don't really see any sort of lesion there, but there's actually a stress fracture that has occurred on this individual. And so if you look then at the image on the left, you can see this hot spot where the arrow is pointing, and that's going to be, again, this is showing up on a bone scan. So you can see where a bone scan can actually be helpful for identifying these relatively small bone fractures, so like a stress fracture or something along those lines. And then on the right-hand side, again, this is just an image taken a little bit later in the course of healing of this fracture. And at this point now, you can see where the bone healing has occurred on an X-ray. But again, the initial X-ray was not sensitive enough to be able to pick that up. Now looking in the upper right-hand side of this slide, you can see a series of lung images. So there's two rows with several images in each one, and these are just different views of the lungs. And so effectively what happened here was a person is breathing in a radionucleotide, and as they do that, you see it showing up in the lungs. And so this is a really good way to be able to assess blockages in the lungs. So you can see where maybe there's some sort of foreign body or other issue with the lungs that are not allowing for the radionucleotide to be able to get into the lung as normal. And then below that, you can see this is another radiotracer that was injected into the lungs to assess the circulation, the pulmonary circulation. So again, you can see where there's really quite a bit of utility in the nuclear medicine in terms of what we can assess. And then finally, in the bottom right-hand corner, you can see here where on in the three-picture panel, you're looking at a coronal CT scan on the far left. On the far right, you're looking at a FDG or fluorodeoxyglucose. So this is basically a radionucleotide that is attached to glucose, and so then that way you can look at glucose utilization. And then the middle image that sort of has the reddish orange tinge to it, that is the overlay of those two images. And so you can see how useful it can be to do this overlay so that you can very clearly see where the glucose is going. So the structure labeled L there is of course the liver, and then right below that there's on either side you can see the kidneys lighting up, and then obviously in the midline in the low pelvis you can see the bladder with that bright yellow coloration to it. So again, you can see that the liver is where this radionucleotide went for initial processing, and then it's excreted through the kidneys and ultimately down into the bladder. So really, from a nuclear medicine perspective, it's not so useful anatomically. It's really more useful from a physiological perspective. So it allows us to assess physiologic function. So we really won't be spending much time studying this modality in this course, but I just wanted to point it out to you because it is a very important clinical modality, and it's growing in its use throughout various specialties. And so I think it's a good thing to be aware of. And so one last point that I just wanted to make on this, where you can get a sense of its usefulness. So in this image, you can see again on the far left, this is a CT, a coronal CT image, looking primarily at the lungs is where you're going to be focused on. You look over at the right, this is again an FDG image, so you can see where the glucose is being concentrated. And for those of you that don't know, cancer is a very, very metabolically active tissue, and so as a result, a lot of blood, a lot of glucose is going to end up going to that site compared to the surrounding tissues, and so it really will stick out on nuclear medicine imaging. And so you can see in the overlay in the middle, there's where that white arrow is pointing. You can see there's a very clear nodule in the lung. That's actually a lung tumor. And then you can see with a black arrow in the upper right hand side of the screen, so on the patient's left side, you're looking at a metastasis that has come off of that primary lung tumor and lodged in the shoulder of this individual. So again, you just get a sense of how, in that case, anatomically it is very useful where it allows you to look for metastases, but again, it tends to be used more for again, looking at pathology and physiologic function than it is to appreciate normal anatomy. So hopefully you can appreciate the importance of knowing your anatomy to be able to interpret images obtained with any of the modalities that we've discussed today. You need to, and what I want you to keep in mind is that you really need to think in 3 dimensions at all times when you're looking at any imaging modality. You also need to remember your anatomical relationships. What structures are located where relative to others. So that'll be one of the primary goals of this course for you, is to review important anatomical relationships. And this will help you immensely when reading a scan of any type, because it'll allow you to look for patterns. And to be good at identifying these patterns, you need to go through a standardized approach to reading images. So the first thing you should do when viewing an image is to identify the imaging modality and the position of the patient. Then identify the region of the body that you're looking at, and then look for the structures that you know in that region that are easy to identify on that modality, as well as others. So there's always going to be those key landmarks that you can use to help you identify those structures. And so the only way to really develop this skill of pattern recognition and knowing what structures to look for on different modalities and different regions of the body is practice, practice, practice. So I encourage you to seek out as many images as you can for any given module to practice looking for the patterns that are important for that region. And again, it'll also be important to go back and review your anatomical relationships using your anatomy atlases, etc., so that you can get a good sense of or a good reminder of where different structures are relative to each other. Now, keep in mind that imaging is also complicated by the fact that you also have anatomical variants, right? So you always have to keep in mind that anatomical variants are common, and so you're going to run into those in imaging. So that's why it's important to have a good understanding of what variants are present, which again, we're not going to go into that too much in this course, but when it is an important point, I will point that out to you. So I look forward to working with all of you in the course, and I hope that this first module was helpful for you.